It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Houston area that have helped change people's lives.
Like our first doctor, Dr. Stephen Rose.
One of the things that I learned early from Dr. Tabar, who was the person in Sweden who did that 2-county trial, and that was my first introduction to real quality mammography and how it should be done. But I learned that we needed to work together and you needed to understand the pathology. So immediately the first benefit was to work closely with the pathologist.
Dr. Rose and Dr. Sutton enticed me to go to a meeting out in California where Dr. Laszlo Tabar was speaking on mammography and sophisticated ways to diagnose early breast cancer. And to say that I got hooked by Dr. Tabar would be an understatement. And so we came back in late 1995 and determined we wanted to form a comprehensive breast center.
At the time that we started this format, we were really the only area in Houston outside maybe the medical center itself in which this was a routine sort of event of meeting on a weekly basis with all the different physicians involved with the breast cancer diagnosis and treatment planning.
It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are.
I think the most powerful thing that we have been doing for close to 20 years is the weekly conference, and it's dedicated to women who are recently diagnosed.
And so it takes an element of commitment on all the different parties involved, but at the same time, when you see the benefit of that as far as our ability to do a much better job taking care of the patient, it's worth every second.
So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth, and George is a very outgoing person and likes to smile and has a great smile, and so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
So follicular unit extraction, or FUE, sometimes also called FUE, is a way of extracting the hairs from the back of the scalp one by one. It's very hard to do because you're aiming for the graft itself. You want the graft to be intact and complete. You want to keep it moist and cool. We have a lot of ways to make that happen. We're very fast in the way we do it, and that's important for graft survival. We have refrigerators in every room. We keep the graft cool on a cooling plate. So we take a lot of extra steps to make sure the procedure is done as efficiently as possible, maintaining the quality and maintaining the graft survival. We also have other amenities that make it easy for the patient to be able to endure the procedure, not because of the pain, but because of how long it takes. Things that we like to highlight to our patients are that when we extract the grafts, they come out clean and complete, intact and healthy. And then we often show the grafts to the patient. We show the grafts to the patient themselves. They can look at them, they can watch us count them. We're very transparent about our numbers. Some places you never really see your grafts, you're not sure about the number of grafts you got in the procedure, but with us we're very, very transparent about the whole thing. If you look up your doctor, often they don't have training in dermatology or plastic surgery. A lot of times when you actually dig into their background, they're family medicine doctors. What we have in our center is, I am a dermatologist, board certified dermatologist. I also have an MD. A lot of times when you dig into this, you find that you're not dealing with an MD. Another thing that I have is a PhD, so it's very, very rare to find a hair restoration doctor that has both an MD and a PhD. I think that it's good to know that there are many ways of doing the hair transplant procedure, especially when it comes to FUE and the follicular unit extraction. Most of what's available are different tools, and I think it's really important for people to realize that the tools are the tools. A lot of times anybody can buy the tool, anybody can implement the tool. What you want to know is, am I going somewhere that uses the tool a lot, that's good at the tool? So we have multiple ways we can do this procedure because we do this so much. So it's good that we have these alternative options.
Let's talk about your bones. Bone health is very important, especially in women. You can get osteoporosis, that's very thin bones. And also there's mildly thin bones, which we call osteopenia. Now, what causes this, or who's at risk for bone thinning? Well, generally it's females. We often see it in Asian people, as well as people with very thin bones and low weight, under 126 pounds. People with red hair, blue eyes, freckles, and fair skin, they tend to get a lot of osteoporosis and a lot of osteopenia. The way you diagnose this is through a bone density scan. That should be done at your doctor's office. Now, if you do have osteopenia or osteoporosis, you need to be on calcium and vitamin D. Generally 600 milligrams of calcium twice a day and 400 international units of vitamin D twice a day. If you take it all at once, that's not going to do the trick. Half of it will go out in your urine. You must take the daily dose and split it in half. Take half in the morning and half in the evening. That way it'll get into your bones very well.
When you talk about Ceci, she's talking about issues that pretty much any lady who has had several children will talk about, that they just feel that their stomach never quite went back to the way it was before.
I've been active all my life, and in sports throughout high school, my collegiate years, ran track and field and competed in Miss Fitness USA competitions and had a flat stomach for pretty much most of my life. I had 3 beautiful girls, But with the pregnancies, I had 3 C-sections also. And so having the flat stomach before and not able to achieve that afterward was kind of like, a punch in the stomach, so to speak. And I wanted to do something about it.
And you can do all the exercise in the world, you can diet all you want, and you will still find ladies that still say, I just bulge a little bit more than I remember. And why do they? It's because that tissue, that connective tissue there of the stomach, has basically been kind of stretched out like a balloon that's been overinflated, or a rubber band that's been pulled too far, and it never will snap back to the way it was before.
I need to start, doing for me now, just getting my body back to the way I wanted it to be. And I really didn't think of plastic surgery, but I did my research, and I'm glad I did. I'm just so happy that I did.
You see all the effort you're putting in, you want to see the results, and that's frustrating for any individual to do something and not see the results from it, and that's where she was. But then after the surgery, once you get that tightness back and fix the tissues that were stretched out by pregnancy, then it just adds that whole measure back to exercise that she wanted to have from before.
The flat stomach, it is there. We've gone on 2 cruises already, and I've been in my bikini. I haven't been able to do that in a long time, since before my competition, so that was back in 1999, so I hadn't been able to do that in a while. I'm full force working out, doing ab exercises, working out with my husband, and running, jogging, just doing all the things that I used to do, but now I can show it off and I can wear a half tank top, to work out in, it's like things I didn't think I would be able to do again, thanks to Dr. Bancroft, yeah.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I thought, okay, well, the only thing that's going to be available is I'm going to have to go in and have my tubes tied, or my husband was going to have to go in and have a vasectomy. I didn't realize there was any other long-term solution. And having the IUD in and having it changed out every couple of years just wasn't an option. That wasn't necessary. We had decided our family was complete.
Gina is a registered nurse, very aware of the potential risks of surgery and of hormonal birth control, and was looking for a way to not have any more children with the least amount of risk associated.
And I talked to Dr. Leibman about a long-term solution, and he said, have you ever heard of the Essure? You should come in and have it done.
It's a minimally invasive procedure that is done in the office under local anesthesia most of the time. It involves the placement of a tiny microcoil into the fallopian tube. And we do it on both sides, and the body's own tissue will then grow into the microcoil and form a mechanical obstruction of the tubes. No cutting, no hormones, and almost no blood loss at all.
Didn't require a hospital stay. Didn't require my husband going in and having a procedure done, which he wasn't really thrilled about having. So it was really, really easy. No downtime, no pain, no, overnight stay. I didn't have to worry about it. The kids were home in the afternoon, and I was fine when they got out of school.
When the procedure is done correctly, the 10-year data says that it's 99.7% effective. So we seldom ever see a pregnancy failure.
I wish that more women knew that this was an option that was out there, that you can make the appointment, you can come into your physician's office, you can have it done during the day with little to no downtime, and have it be just as effective as an overnight, tubal ligation stay in the hospital.
She was just delighted she didn't have to worry about birth control anymore, and certainly not the risks of hormone therapy associated with the contraceptives anymore.
For more information on any of the amazing doctors you've seen on today's show, just log on to our website, bestdocsnetwork.com.
BestDocsNetwork.com, also the #1 medical video source as far as educating the public. Up next, our next best doctor. It's bariatric surgeon Dr. Robert Marvin.
My teenage years and my 20s, it's been difficult. I've been able to interact and do things with people, but without difficulties. Right now, I just have like muscle and bone problems and things like that, but no like diseases or anything. That hasn't affected me in any way.
When a patient gets over a body mass index of 50 and Mr. Sowell's at a body mass index of about 74. He does not have a normal life expectancy because of his weight.
You know, with dieting, you can go out and you can still eat a ton of food, but with the surgery, you try to eat those things, you know, and you have physical problems. You're not able to eat that much as you would to put the weight back on. So the fact that it keeps you in check, but yet it's still, you know, it's not something that you want to abuse in any way. It's something that you really want to take seriously, that, you know, you're ready to live a normal life. You know what I mean? When you're like me and you're almost 30 years old and you've had difficulty, you know, having fun and doing things, you know, it gets where it's tiresome.
Well, Mr. Sowell does not have insurance coverage for this operation. And even if he doesn't have any insurance coverage in the future, if he were to develop the other medical problems related to his obesity, he is going to get treated in this country, and it's going to cost a lot of money. So really we're looking at a time bomb in terms of resources necessary to take care of him. And there's nothing else short of this operation that's going to make a significant difference in terms of his weight. There just isn't.
Because, you know, there are so many people that battle this in their own life, you know, being overweight, being obese, you know, and we all know, anyone who's struggled with that knows how difficult it is and knows how tiresome it can be. Through this surgery, there's a way to get past that. There's a way to feel good. There's a way to have a normal life and so forth.
This is the best shot he has at getting control of his weight, and this is overall probably the lowest cost way to do it. And that's really not generally recognized, but that's the truth.
Keith had severe sinus problems until he met Dr. James Ludwig. To find out more about Keith's story and other life-changing stories, log on to bestdocsnetwork.com.
Well, from the standpoint of non-invasive treatments to the face, such as the Botox, that helps reduce the wrinkles. So you want to prevent them before they actually establish themselves long term. So that's what the Botox is going to do. It's going to paralyze those muscles that cause the wrinkles. Therefore, you don't get the wrinkles.
Botox is more for like the fine lines that I have around my eyes or my forehead, or especially, you know, in the zone where we make the little snooty face. And over time, you know, the creases get worse.
In addition, anybody who has the aging process, which is the natural creases or folds in their face, that's where the filler can come in.
The filler, I come in for my lips, just to soften the area right here where it starts to wrinkle. That didn't happen until after my mid-30s. I started getting a little fine lines around my lips. So she came in, it's really not to have big lips, it's just to soften this area. And in my folds right here.
There are different types of fillers on the market now. The most common is a hyaluronic acid type filler, which means it is a protein that's normally found inside the skin. And by injecting this type of filler, it attracts water to the area and therefore plumps the area out.
If I get a Botox procedure, I can come in on my lunch break. It's very quick. I can go back to work. I don't look crazy or weird.
Anybody can be a good candidate for Botox and fillers as long as they're not on any blood thinners, okay? Or if they have any allergies to any specific medications, such as the Botox or the fillers.
I believe the non-invasive route is the better route. And then if that doesn't help, then you may have to have some type of plastic surgery done. But there's all kind of things that you can do now between the lasers and the chemical pills and really good products and injectables. I believe that you can do a lot and you don't have to so far go as far as getting cut on. Mine is to really look refreshed and, you know, nice. I'm not trying to look 20, I just want to age gracefully.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda's a patient that presented to my office complaining of shooting pain, down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
Told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight and they clamp on the nerve, are the protective covering, which we call the flexor retinaculum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is it's not a surgery where you're really held up for a while, where you have to, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you're reattaching muscles and putting in screws, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
After undergoing a mastectomy, Colleen turned to Dr. Evan Feldman to help change her life. To find out more about Colleen's story and other life-changing stories, log on to bestdocsnetwork.com.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
Do you have headaches? Of course you do. You're a human being. We've all had headaches. There are different kinds. There's migraine headaches. Those are not the most common kind, but they're the most bothersome. They are usually pounding, throbbing headaches, usually on one side of your head, often accompanied by nausea and vomiting. Sometimes there's light sensitivity or noise sensitivity. Best way to get rid of those is to take some over-the-counter pain medication, even drink a cup of coffee real quickly. Sometimes going to sleep will help get rid of one of those headaches. By far the most common headache is the muscle headache or a tension headache. This is the headache that may last days and days and days. It's usually a squeezing type pain like a band around the top of your head, or it can be right in your temples or your forehead or the base of your neck. It's not throbbing, it's steady, and it's caused often by stress, and sometimes it's caused by taking pain medication too often. It can be like a rebound headache. So what should you do for these headaches? There's medication for them. First of all, try relaxation, try sleep. Exercise always helps headaches go away quickly.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
Infertility itself is tough enough to experience alone. A lot of patients do feel like they have nowhere to turn to, but fortunately, we're here in the community. We're lucky that at Dallas IVF, we have a one-stop shop type of center where the patient can come and receive a whole wider range of treatments and to help them get pregnant.
Some couples come to us because there's a male factor, sperm is poor. Some couples come to us because the woman has endometriosis or does not ovulate well. There's a whole range of reasons why couples come to us. About 15% of the patients we see in the office have what's called unexplained infertility. They have a completely normal workup, yet they're still unable to conceive.
Here at Dallas IVF, we offer a wider range of infertility treatments, ranging from basic aggressive therapy like taking medicines such as pills to grow an extra 1 or 2 eggs, combined with something called insemination or IUI. That's where we'll take the partner's sperm and place it closer to the eggs within the uterus. Another treatment that we offer is a very aggressive treatment called IVF, also called in vitro fertilization. What that is where everything that occurs in the tube, which is particularly fertilization and embryo development and growth, all that occurs in a glass dish in a lab. So in that way, we can actually find the healthiest embryo and place those back into the uterus.
If there's a structural reason why they can't conceive, the tubes are blocked, there's fibroids, polyps in the uterus, endometriosis, for these people, we often have to take them to the operating room and try and correct those abnormalities. We're fortunate we operate at Forest Park Medical Center at Frisco, which provides the full range of services that we need on all our surgical patients.
Infertility and infertility treatments is like an emotional roller coaster. Hope and excitement followed by despair and frustration, followed by hope and excitement. But one day, there will be a little baby at the end of the road. It's so rewarding, especially when the families come back and they are so excited to show us their little child. It really is the best part of what I do.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the Houston area that, of course, Candace, have helped change people's lives.
And if you'd like some more information on any of those doctors, just log on to our website, bestdocsnetwork.com.
And if the public has a comment or question for us, we'd love to hear from you. Send us an email, info@bestdocsnetwork.com.
Thanks for tuning in. We'll see you next week.